All right, we continue to be on your side with Heart Health Month all February, and right now, guess what? We welcome in studio to Dr. Kristen Brown, the Structural Heart Director at Baptist Health Princeton Hospital. That's a mouthful. How are you doing?
I'm doing well. Thanks for having me.
So we're talking, it's valvular, but it's valve disease is what we're talking about today?
Yes.
What is that?
So valvular heart disease is when one of the more of the heart valves within the heart are defective. Typically, valves open and close to regulate blood flow within the heart, but when this doesn't occur correctly, valvular heart disease occurs.
Yeah, the heart is one organ, but there can be different types of ailments when it comes to heart disease. What about with valve disease? Are there a variety of those types?
Yes, there are. There are typically three types of valvular heart disease.
Okay.
There is stenosis when a valve doesn't open well, regurgitation when a valve doesn't close well, and then absence of a valve altogether. We see that typically in congenital heart disease.
Okay, what causes this type of stuff?
There's typically many causes of valvular heart disease. Age, infection, congenital heart disease, as I mentioned. There's several different risk factors for valvular heart disease, including ischemic cardiomyopathy or coronary artery disease, which is one of the main things that our generation or older generations experience, and also a strong family history can put you at risk.
So if we are experiencing any type of trouble or having an issue with it, some symptoms that we can be aware of?
Yes. So there's no specific symptoms of valvular heart disease, but most patients present like most of our cardiac patients with chest pain, shortness of breath, difficulty breathing, and palpitations and fatigue. Some patients have no symptoms at all, but some patients also have symptoms that can progress slowly over time, and they don't really realize. They adjust their lifestyle to accommodate, and they don't realize those symptoms are actually pointing them towards heart disease. So.
Yeah, well, I know you and your colleagues are very talented and skillful. There are treatments out there that can help. What are those?
Yes, so aside from medications, there's surgical interventions, and then the new upcoming transcatheter options that are on the market. Depending on the severity of disease, the type of disease, and the overall health of the individual will really guide the physicians on which option to offer.
Yeah, I'm going to pick up the prop here because that's what I like to do. So just tell us real quick, what are we talking when we talk about valve disease so that they can see, kind of point that out for us.
So these are valves within the heart, mitral valve, tricuspid valve, aortic valve. And these are largely the ones that I work with. This is an example of a transcatheter option. It's an aortic valve TAVR that we implant percutaneously so you can avoid a surgical cut. But this gives you a good example of valve disease. We also can do clips and implant valves in the mitral position and tricuspid position as well. So this is what I deal with every day.
Well displayed indeed. And I've got one of these in me, right?
Yes.
Okay, that's good news to know. We're talking with Dr. Kristen Brown. Great job, and valve disease. And you're watching WBRC 6 News at noon.